So, in your view, is there ever a case for statins?
Yeah, I do think there are situations where they are beneficial. Um, I think those benefits are a lot lower than we've been told that we've been led to believe. There are a lot fewer people that are going to get that benefit than we've been led to believe. But in certain situations, certainly someone who has heart disease doesn't want to address the underlying issues, isn't willing to make the changes so that they can reverse their insulin resistance through diet and lifestyle, that person is probably going to get some benefit from taking a statin. Interestingly, it might have nothing to do with lowering their cholesterol. Statins, as many people may be aware, also have anti inflammatory properties. And that's where any of the benefit that we see from them might be coming from. And the other concept for people to understand is if you're lowering your total body cholesterol, yeah, you're going to be lowering the bad cholesterol with the good cholesterol, that's in there. And for the doctors who don't get into that nuance and don't understand that nuance, yeah, you're going to be doing a little bit of benefit by lowering the bad cholesterol. You might be doing worse things by lowering the good cholesterol, but in the end, maybe there's a little bit of a net benefit. And this is why I think some of the scientific studies do show benefit to statins on a large scale because so many of us are metabolically unhealthy, and aren't addressing that. You're going to be able to demonstrate some benefit to statins. They're very small benefits, but there is some benefit. And so, yes, some people, the answer is, okay, take your statin and hope for the best. I would rather people focus on the insulin resistance, the metabolic health, the underlying issue, and then get themselves in a situation where the statin is clearly not going to be beneficial anymore. And then you don't need to take it.
I made a video a few months ago talking about how I really respect people like yourself and Dr. Berry and Dr. Chafee because, um, and people like Nina Teicholz because you really, because you want to go out there and say what you know is right, you're really kind of pushing against the grain,
Mm-hmm.
literally and
Yeah.
figuratively. You're really pushing against the grain. So, how does your opinion about things and the way you're handling things with your patients, how does that affect your relationships with your peers?
There are some challenges that come with this that I'll say, certainly there are the attacks that come on social media. And for the most part, I just ignore those at this point. They really don't matter to me. But, when I'm dealing with my colleagues and we have shared patients and we're talking about the management, there are conflicts that come up here. Ultimately, that's where the patient becomes so important and empowering people to understand these decisions and to make the decision for themselves. When we're talking about something like, should I take statins or should I not take statins? One thing I'm very clear about telling patients is that's not my decision to make. That's your decision to make. But here's the information that I know. Go talk to your other doctors. Let them give you the information that they feel is in favor of you taking it. And then at the end of the day, you, the patient, need to make that decision. And like I said, what I want to empower people to be able to say is, I'm not taking the statin, but that doesn't mean that I'm ignoring my health. I've just chosen this different approach to improving my health. And that has now put me in a situation that I'm fairly convinced that that statin is not going to be a benefit to me.